name is Slater. I'm originally from Silent Springs, Arkansas, so it's a little town up near the University of Arkansas in Fayetteville. For undergrad, I went down to Baylor University in Waco, Texas, then attended medical school at University of Arkansas for medical sciences in Little Rock, Arkansas. So I'm finishing up that currently, and I'm going to be headed down in the next couple months to do residency in otolaryngology and head and neck surgery at Baylor College of Medicine in Houston, Texas. I did all the editing for like all of the 4 medical videos as well as the instructional video, and then did some of the narration for the ENT video. So like the ENT video that you emailed about, it's a 2-part video. So the cartilage tympanoplasty, there's one of the graft formation, which was narrated by me, whereas graft placement was narrated by Ashton Rogers, another colleague of mine at UAMS. So inspiration kind of came from some of my background within video editing and really enjoying that as growing up with like high school and a little bit of middle school, doing some video editing for different competitions and stuff like that. And also pairing that with one of the best ways I learn is visually, seeing stepwise processes as well as just being able to see unique cases. And so that combination just melded well with research interests within the field of surgery. And so CSurgeries was able to get involved and connected with Dr. Gresham Richter here in Arkansas. And so through different avenues through him, as well as other attendings at the university, was able to figure out a couple of different surgeries within the fields of interest. One of my friends was in anesthesia and needed some help with the video part of things. And then within the field of ENT and otolaryngology, was able to get involved with those. And then was also able to do one of the instructional videos with Dr. Dustin Chow for the platform itself. So specifically with the pediatric blocks regarding the anesthesia videos, the focus is truly on decreasing opioid usage within the pediatric population, because there's a lot of negative effects, short-term as well as long-term, and so increasing the usage of blocks, whether that be that rectus sheath block or pudendal block that we did the videos on. Those are to decrease opioid usage within surgery as well as after surgery. And so just prioritizing that there are always different methods, maybe before jumping to an opioid medication, whether that be in the pediatric population or the adult population. That's a high priority with that high morbidity that these medications can have, as well as the addiction potential that these medications can have. So I would say regarding the videos, those are really helpful tools to learn techniques and to see them done by other people, but having a mentor or having someone well-versed within your own hospital system, or visiting someone else in a neighboring hospital system that has the ability to do these techniques and do them well is really vital. When you don't have that opportunity, that's where a lot of these places like CSurgeries gives you kind of the tools to be able to start moving through them yourself, but having good mentorship, having good leadership, especially when you're first doing some of these new and innovative techniques. I think that's really helpful in making sure you're honing them before you're doing them personally by yourself. Obviously, some people don't have the opportunity to do that due to their location or lack of resources within the country or even in the city. And so that's where CSurgeries is really highlighted as a tool. I think, especially going into ENT residency, I would love to continue to do those specific types of videos. But I think finding a good balance of the way you present information, whether that be through text as well as through video instruction. I think there's a balance, especially when sometimes people watching the videos don't have audio, giving text to support some of the steps that you're doing, whether the video be an ENT, anesthesia, or any of the other surgical or non-surgical specialties. I think having the ability to cater to all those watching, whether they're able to listen, able to just watch, or do both, be able to reiterate these techniques so the learner can learn as best as they can and be able to provide the best patient care.